Preterm birth is a leading cause of death of babies that are born without any structural abnormalities. And part of the problem with preventing preterm birth is that we don't actually understand the women who are more likely to have a baby early. So a lot of the work that we do in Sheffield is around trying to identify women at high risk of preterm birth so that we can intervene and prevent premature delivery. And in this respect, my group, particularly from the Sheffield Teaching Hospitals and the University of Sheffield, have been looking at ways and means of looking at the neck of the womb to identify these changes well in advance of when women will go into preterm birth. So we've been looking at a range of techniques called spectroscopy, which look at the cervix and identify very subtle changes in the cervix, some of which occur many weeks before a baby is born early. Thankfully, very recently, we have had funding from the NIHR, the Invention for Innovation Scheme, who have funded us in the sum of nearly £1 million to investigate a new technique for identifying women at high risk of premature birth. Currently, there are not many accurate methods of identifying women. So women who have had a previous premature birth are probably the only ones that are known to be at high risk. But the vast majority of preterm births occur to women who've never had it before. And therefore, the techniques that we're pioneering in Sheffield will identify women who've never had it before, but who are at risk. Hoping that these techniques can be used very early during pregnancy, preferably before the detailed scan at about 20 weeks, so that those at risk can then have interventions and treatments and advice that helps to reduce the chance of a baby being born early. The question is always, what would you do if a woman was identified to be at risk? Now, there are new treatments that seem to defer delivery prematurely, but the difficulty at the moment is that we don't know which women will benefit from these new treatment interventions. But if we are able to identify women at real risk, then we can target those women for treatments way before preterm birth occurs to reduce the risks of either the baby dying or the extremely premature baby surviving with cerebral palsy and other problems associated with prematurity.